With us today, we have a number of speakers to talk about the overall issue of childhood obesity, as well as Senate Bill 455. We don't have that bill before us, but we do want to talk about what impact that bill will have in regards to student achievement and student health. First speaker we're very honored to have the president of the West Virginia State Board of Education, Gail Manchin. And she has been instrumental in leading the charge, both in chairing the Wellness Committee of the State Board of Education with a number of health experts, but also in Move to Improve from its original inception. And we really are honored to have her here to talk with us. Mrs. Manchin, please come forward. And
thank you.
Thank you for being here.
No, thank you. Thank you not only for having me, but thank you for creating this wonderful opportunity for people in West Virginia to really stand up and realize what we need to do to support a healthier lifestyle and quality of life for our children in West Virginia. And I believe it goes without saying that as we talked about last year, Feed to Achieve, and this year, Move to Improve, that these are really integrated in such a way that it's hard to separate where one ends and the other begins. You know, we talk about obesity in this state, and then we talk about poverty. And so we think about poverty, we think about children not having enough food, and yet we have this obesity problem, but we realize that the obesity problem comes from two things. First, children not having the right nutritional foods in their diet, and then second, the lack of movement and physical activity, and so they work hand in hand. And I'm very proud to have Rick Goff from the Department of Education here with us today, who certainly is working diligently every day on our farm to table, providing our children meals from scratch, fresh produce, using products produced, grown right here in West Virginia. So that began to address, from the bill last year, we began to address the nutritional issues. And now this year, to take it a step farther with the Move to Improve. You know, I was talking to Senator Unger, and I said, I think sometimes we don't realize that when children come into a classroom and sit down at their desk, and particularly young children, talking about K through our elementary school, but certainly even up through high school, that those children sit in those desks for a long time during the course of a day. And I know that you all, particularly being in session, you have committee meetings, you have your floor sessions. How difficult, and when do you find your mind beginning to wander from your task at hand because you've been sitting in that chair? So the 30 minutes that we believe is very productive for the child is not an addition to the day. We're not asking a teacher to remove art or cut off science. What we are saying is during the course of a day, we can have children stand up, move around, walk around the room, you know, repeating numbers, repeating letters. I mean, incorporating, we talk about blended learning all the time, but it's that matter of being able to incorporate in a child's day movement, physical activity, nutritional assets for that child, and then to improve, increase, and sustain their mental capabilities. We talk about dealing with children holistically, and I think that this is just another great example of what we need to do to make sure that we are on that continuum of providing the best nutritional foods that we can provide for that child in the school, because that may be the only place that they are receiving that nutrition. And then providing the good physical activity, because many of these children live in areas where they don't have playgrounds or areas outside where they can play before, after school, or on weekends. So whatever we can provide for these children, I know that many times schools feel like they have more and more piled on them. But truly, when you can spark and re-energize children, they're going to be more engaged then in the learning process. So I thank Senator Unger for the bill, the work that the committee has done. Certainly Senator Stallings has been a great asset on the Wellness Committee and providing us not only medical data, but sort of that liaison between what's happening over here in the legislature and what affects us in the Wellness Committee. So it is a team effort. I don't think anything that is ever accomplished that is very good is done by one person. It comes from a team of people that share a passion and a belief that we owe the children of West Virginia the very best quality of life and education that we can provide them. So thank you.
Questions? Mrs. Manchin? Senator Plummer.
Thank you, Mr. Chairman. Just a quick question. In our health committee this week, we took up a bill dealing with requesting the DHHR to request a waiver for our SNAP program to exclude from SNAP benefits soda. Does the board or the Department of Education take any position on that?
Well, I know our position has always been that we should not have pop in the schools. So, Rick, specifically to the SNAP program, can you?
Leave of the committee, Rick Goff.
Thank
Maybe
you.
we're jumping ahead of ourselves here. He's on
You
the
can
list.
answer the question. Go ahead.
Thank you. Our policy dating back to, I think it was 2008 when we developed that, has always been to not have children have access to the sugary sodas or any beverages, the high sugary added beverages, including the Gatorades and the super caffeinated beverages, because research shows that soft drink consumption is a leading contributor to childhood obesity all across the nation. And they have access to enough of that stuff when they're outside our care. So our policy's been right in line with the Institute of Medicine's recommended standards. But as far as the SNAP benefits, and I haven't been involved in that discussion.
Okay, you would consider that sort of outside of your area?
Yeah, that's probably not within our purview.
That's, is that through DHHR?
Sure.
Well, we would certainly not, we would not support POP being in that from the educational side of it.
Okay, thank you.
Further questions, Mrs. Manchin? I have one in the sense that I know that your wellness committee has been talking about it, and you've been exploring, looking at the school of excellence, and one of the criteria being nutrition and physical activity. Right now, it's not. I guess it's not considered. But is it? What are your thoughts on incorporating that a school of excellence should have that area looked at as far as being part of a criteria to qualify as a school of excellence?
Well, I think that when we talk about schools of excellence, of course, our primary concern is student achievement and student growth, how much children grow from the beginning of the year through the school year. So that is always our primary goal, that we give children the very best education possible. But we know that many things contribute to that. The climate of the school, the attitude of the school, what happens in that school during a school day. And so certainly all of those issues do become a part of the excellence of the school. I mean, I think that is a good way to look at it. So yes, we are looking at all of those factors and how they contribute to the success of that student. I think if you go into a school of excellence, where children are engaged in learning and doing well, you will find these other activities are following. They are things that, again, that keep children energized, engaged, healthy. They have good food, their minds are alert, they have activity, their minds are alert, and so those children are going to do better. So yes, that would be something, we are looking at all of those factors when we talk about the climate and safety of our school and how it contributes to the success and achievement of its students.
Thank you very much. Thank you for your leadership on this.
Well, Thank you.
Next, we have Charles Henline, who's the Deputy Superintendent of the West Virginia Department of Education. He also has been very instrumental in working on draft after draft after draft of Move to Improve. Welcome. Thank you.
Mr. Chairman, members of the committee, thank you very much for having the opportunity to let me speak to you today. And I'd also like to thank Rita for her work on the bill. You know, today's children are much different than we were in our childhood. They're technologically literate, and they spend a great deal of time with technology, leading to somewhat of a sedentary lifestyle. They come to school, as President Manchin said, and they're in a seat for 6 hours. They don't have quite the activity that we might have had during our tenure in our school systems. So this bill, I think, addresses the issue of physical activity, physical movement throughout the school day, and I think the critical word in the bill is integrated. Teachers can find the opportunity to integrate that physical activity throughout the school day without detracting any from the content areas that they teach, as President Manchin said. We know from some of the research that has been done in some of the schools that implemented Let's Move back in 2010 with Mary Weichel as our physical education coordinator. The research coming from that initiative showed that there were fewer discipline problems existing and more focus and engagement in the classroom through that Let's Move activity, which is now ensconced in this bill through the 30 minutes of physical activity throughout the course of the day. So I'm very supportive of this bill. I appreciate the work that's been done on it, certainly the leadership of the Wellness Committee and President Manchin, as well as Chairman Onion.
Thank you, Dr. Henry. Any questions? Questions about members? In regards to, yes, Senator Stocks.
Thank you, Mr. Chairman. Again, yesterday, during the Senate Health Committee, there was some concern, I think, about whether this was going to interfere with other classes or anything like that. So that I'm really glad to learn more about the integration of this. And certainly, most of our feeling that this would be integrated throughout the entire day. So whenever this bill is before the Education Committee, I think we certainly appreciate you all being there, showing your support. This makes a lot of sense to me as well. But there were some pretty interesting questions at our Senate Health Committee yesterday.
Certainly.
So,
I was driving in yesterday, and on the radio I heard a report that if a child is obese in kindergarten, it's a significant chance that obesity will continue throughout their life. And I recognize that, and I know the reports on obesity and the health of our children in West Virginia is not as good as we'd like it to be, and I'm hopeful that this bill will support that work.
you know, one of the other things that we have in our favor, I believe, is a really good data and the ability to see what impact this might have as we go forward. The same thing with some of our oral health issues. You know, we have our Oral Health Coalition has a plan. We have the Cardiac Project that measures, you know, BMIs, and we can see what impact this will have as we go forward for the health of our people. I know the Robert Wood Johnson folks are certainly paying attention and have given some monies to places that are able to actually show positive benefit, public health, and outcomes.
Okay, thank you. Any further questions? Yes, Senator Cook.
Yes, thank you, Mr. Chairman. During our interim committee meetings, we had a report concerning 11-year-olds and how many were obese throughout our school system. And I think it was 48%. Do you agree with that number?
Senator, I couldn't acknowledge that without the data in front of me, but I'm sure that your recall is better than mine.
I don't have it in front of me either, but that was my recollection. It was 48% of all 11-year-olds were considered obese. And it was seemed to me that what we're talking about here, the move to approve act would assist in that regard. Also, the SNAP benefits that we discussed earlier to prevent people from getting for their children sugary soft drinks, cookies, things like that. That's a health issue for the children. Do you agree with that?
I do.
Thank you. Thank you, Mr. Chairman.
Thank you. In your packet, members, what Dr. Henline was talking about is an article from the New York Times that talks about a major new study on over 7,000 children, found that a third of the children who were overweight in kindergarten were obese by the 8th grade. So that's there. So thank you. Okay, next we have Mr. Richard Goff, Executive Director of the Office of Child Nutrition for the West Virginia Department of Education. Mr. Goff, please come forward. Thanks for being here.
Thank you, Senator. I want to thank Mrs. Manchin's leadership. I've had an opportunity to work with her for dating back when she was the chair of the Healthy Lifestyles Coalition. And also Chuck Heinlein's leadership. It's been a pleasure to work with him, and he supports all of our efforts. I just wanted to give you a brief update on the Feed to Achieve legislation that passed last year. And I spoke with several of you several weeks ago, but we're moving right along. This coming year, I think you're going to hear more about the rollout and marketing of Feed to Achieve to make the concept, the whole idea of Feed to Achieve. Our goal is to have the public and the people in West Virginia, when they hear the term Feed to Achieve, to know that they can contribute toward eliminating childhood hunger in West Virginia. Also, we're working with some large blue chip companies to try to secure funding. We spent most of the last few months back since April when the bill passed trying to lay the infrastructure, put that in place. We had no mechanism to account for or receive funding if someone wanted to give funding. And we also needed to make sure that the programs, as far as breakfast and lunch, were readily available to students throughout the state of West Virginia. We've worked this past year to ensure that, to realign breakfast with the school day and make it easy for student access. So that's where our efforts have been. It is kind of odd that we have in West Virginia, it's sad that we have a childhood hunger problem that is running concurrent with the childhood obesity epidemic, but those two run hand in hand. So when we implement Feed to Achieve, and we want to make sure that all children have access to at least 2 nutritious meals per day, that we do it responsibly and make sure they're nutritious, and we do not promote or contribute to the childhood obesity epidemic here in West Virginia. The thing about Feed to Achieve is it's piggybacked on the federal programs that already exist, and I think the bill passed without a fiscal note. So I think the future looks really bright for Feed to Achieve, and the focus moving forward will be building those private sector partnerships that the bill alludes to.
Thank you very much. Mr. Goff, do you have any of the preliminary research or statistics in regards to participation rates, how they're jumping in regards to the breakfast participation?
Yes, sir. Our office, as you know, administers all federal child nutrition programs, most notably for you all in the public school sector is breakfast, lunch, and we do have an after-school snack program as well. We process those claims and we collect that data, and we have it monthly, and we have it dating back for the last 20 years. So what we've noticed is a significant, as we put these breakfast strategies in place as a result of the Feed to Achieve legislation, the breakfast participation it's astounding what we've seen, the movement in it upward. Let me give you an idea of what I'm talking about. For the last 15 years, breakfast has hovered around 28% participation statewide, meaning that on average 28% of the kids in West Virginia ate breakfast. While we had 60% of our kids were needy. So we had 60% of our kids qualifying for free or reduced price meals, and we were only feeding 28% of the population. And what we found is that was due primarily because of the timing of breakfast. It's the startup of school, the kids are arriving, the buses are late sometimes, the bells, tardy bells ringing, and they want to discuss their evening about their boyfriend or girlfriend, and breakfast wasn't a priority. They were hungry, but they had to make a choice. Feed to Achieve realigned breakfast and created the requirement to have breakfast after first period, breakfast in the classroom, or a grab-and-go breakfast, whatever the school fit best for the school. Our breakfast participation, Mason County last year fed almost 80% of their kids, ate breakfast every day of the year. And it's mind-boggling, the movement that we've seen. We tried for the last 20 years since I've been at the department to get movement out of the breakfast program. And it would go up and it would go down, and there was probably a 1% variance, and we were happy if it jumped a percent. Our most recent data is up around 48%, 45%. And our goal, the immediate goal, is of course to feed at least the needy children. And we track that. We track it monthly, and we can provide that to you at any time, by school, by county. So we've noted, it's unreal what I've been able to observe in the last 2 years in West Virginia. Next year it's going to be phenomenal, I think, as far as and you need to know, as that goes up, federal revenues come into the school system. The cost associated with feeding kids, 55% of it is in the form of labor. So it's not really in food like you would think. So as the federal revenues come in, that gives some relief to the general funds in the public school system. So it's a win-win for everyone. So it's significant what we've seen just this year alone, Senator.
Any questions, Mr. Gall? Thank you very much.
Thank you.
Appreciate you being here.
Thank you.
Next, we'll call on Laura Dice. She's the Assistant Coordinator for Keys for Healthy Kids in Charleston. Laura, welcome.
Thank you all, and I just want to say I appreciate all the time you've taken out to listen to us speak, and I thank you for the invitation. So I just wanted to quickly talk about how we as Keys for Healthy Kids address childhood obesity with a story from the director who could not be here today. She's actually with patients, and 4 years ago she was working as a pediatrician in a clinic, and she had one patient named Deshaun who, as much as she worked with him, he was not able to lose the 100 pounds extra that he was carrying. She worked with him for over a year on improving his nutrition and getting more exercise, and he lived in Charleston. It wasn't until he moved to South Charleston, when he had more access to physical activity and grocery stores, that he was able to lose 100 pounds. So in Charleston, he did not live near a grocery store, so they ate food from the gas station or fast food, and his parents didn't feel safe enough for him to go outside and play. By moving to South Charleston, he lived near a park, and so was able to go play, and then also had more grocery stores and more fresh fruits and vegetables available. So by changing the environment where he lived, he was able to lose 100 pounds. So Dr. Jeffrey applied for a grant from the Robert Wood Johnson Foundation. And that's how Keys for Healthy Kids started, from a grant from that organization. And we have worked for the past 4 years on addressing childhood obesity through policy, system, and environmental change. So we're trying to change the area where kids live so that it's easier to make the healthy choice. In the beginning of this 4 years, we concentrated on a lot of school garden projects, and we created a state network of school gardens. So you may hear more about that in the news. And also on nutrition policies and child care centers. This past year, we've been working with teachers and principals in certain parts of the state that have worked to increase physical activity in the schools. And so in your booklet that you have before you, called Why Our Kids Need to Get Moving, you'll see some of the examples that we're talking about, specifically Mingo County, and then Rick Thomas from Wood County. And we call these the champion principals and teachers, and even a superintendent is mentioned in here. So this is how Move to Improve will be implemented. So we definitely support Move to Improve, and we've held lots of focus groups with principals and teachers on how this could be implemented into the schools. So if you have any questions, I would be happy to answer.
Okay, questions by members? Questions? Laura, next is a Tuesday. Tell us what's going to happen Tuesday at the Capitol.
We're very excited. We've been putting a lot of planning into this. It's Kids and Families Day at the Capitol, and over about 400 kids will be coming to the Capitol. 200 of them from Mingo County who are featured in this booklet, along with their principal, Sabrina Runyon. So we're going to have over 30 exhibits on anything from school gardening to physical activity to you name it, lots of activities for kids. We're going to be having raffles. And so we welcome you to come down and meet the kids.
So at least 400 are going to have 30 minutes of physical activity.
Yes.
At
Yes.
the Capitol, right?
Part of the day involves having a physical activity session. So I'm not sure what that time will be, but come down and check us out, and you may see us exercising.
Okay,
Thank you.
Questions by members? Any questions? Well, Laura, thank you very much for your leadership on all of this, and particularly your leadership in the DTHE as well.
Thank you so much. I appreciate it.
Thank you. Next, we want to hear from Christine Campbell, who is the president of the American Federation of Teachers here in West Virginia.
Good morning.
Good morning.
Thank you for allowing me to speak today. AFT West Virginia supports the Move to Improve initiative because we understand the importance of increasing physical activity for the health, development, and academic success of our children. Experts have confirmed what teachers have seen for years regarding the importance of physical activity and the link between children's brain development and achievement. Nationwide, less than 10 states require daily physical education in every grade. And although West Virginia's efforts are progressive, we have to support county school systems to increase physical activity in every child's education. We have an opportunity to lead the nation in developing innovative strategies that actively engage students in the classroom and beyond. Given the staggering statistics of child obesity and the health risks involved, it's imperative that we work together to address this problem. Our teachers support increased physical activity, but in turn, they need to be supported in their efforts to creatively integrate this initiative into their schools and classrooms. Based on the information and examples supporting healthy lifestyles with Move to Improve, teachers will be more successful implementing the requirements with opportunities for professional development and resources to incorporate this important aspect of child development and learning. Many of our teacher prep programs include cooperative learning and innovative instructional strategies, but don't necessarily link physical activity and content area instruction. Providing flexibility and collaboration will allow teachers to develop creative lessons to meet these requirements, which will improve the health and academic achievement of our students. Given the developmental level and content, integrating physical activity into the elementary classroom may be easier than transitioning middle school students. Intramural sports are recommended middle school concepts to address the health and social needs of children beyond the primary grades. The push over the last 10 years to decrease activity in exchange for additional seat time has not improved student achievement. It has forced schools to discontinue these programs to make time for increased standardized testing. Teachers would welcome the chance to offer intramural and extramural activities in our middle schools again. Shifting our focus from seat time learning to active learning is also an opportunity to partner with community organizations to provide physical activity equipment in our schools. Through Reconnecting McDowell and in collaboration with WVU, one area in McDowell County has been awarded a grant to add more playground equipment and walking trails for elementary and middle school students to utilize on-site during the school day and beyond. Many elementary schools have insufficient playground equipment. Most middle schools have a limited or non-existent play area, and very few have any equipment to encourage physical activity. If we truly want to increase physical activity and reduce child obesity, we have to invest in resources to support these efforts. Another obstacle may be instructional resources to aid teachers in delivering effective instruction that promotes physical activity. One available resource for integrating physical activity in all content areas is AFT's Share My Lesson, and I believe you have an example on your desk in front of you. This website is created by teachers for teachers, including individual and unit lessons crossing all subject areas and all grade levels. We've already pulled together a set of lessons currently on that website to incorporate physical activity into the context-specific lessons. And the lesson you have before you is actually has to do with speed and motion and shows how you can go through there. There's actually pieces to download that integrates technology and integrates physical activity in a science lesson. So this is just one example of things that we can provide, and we are willing to work with our Share My Lesson folks in AFT West Virginia to develop more lessons to add to the list that's already on the website, which is going to be an important piece in integrating this initiative. So AFT West Virginia is committed to working with lawmakers, the state board, and local school systems to expand and enhance physical activity in our classrooms. But we need all stakeholders to work together to ensure our children not only have the best public education, but develop a healthy lifestyle that will enhance their success and increase opportunities for the future of West Virginia.
Thank you. Any questions? So, in regards to this Share My Lesson, is that accessible to all teachers, or?
Yes, it's free, it's accessible to all teachers, parents, anyone can get on this website. All you have to do is register.
Okay. And then they'll have different lessons of how to integrate the curriculum into activities that brings the body and the mind together.
Yes, there are lessons of all kinds on the website. What we have done is worked with National to pull together a list specifically for this area and be able to send that out through to all our members. Here are lessons that actually integrate this particular.
So this is new as far as pulling it together under the Move to Improve. That's something that AFT West Virginia has done to help
Yes.
with the members and teachers
Yes.
throughout the state. So this is new in the concept of a subsection.
We did something similar 2 weeks ago. We pulled together lessons that talk about safety, water safety, and
Water safety.
so as things come up in the state, we have access to get people to pull specific lessons to make it easier for teachers to get things that they need currently based on current events.
Now, I know that I've heard some concern from others, members and others, that there might be a pushback by teachers in the sense that, here's another requirement that's placed on them. How would you respond to that as far as teachers being concerned about another requirement?
Well, I certainly think that if you put exactly 30 minutes and it has to be consecutive time, I think having opportunities to spread that out over the course of the day is going to give teachers the flexibility to figure that out. I think they take on things like this because they understand it, they know it works, and they're willing to do it. But they need the support to say, yes, we're going to let you figure this out and give you the time and resources to create lessons that really make sense and increase that physical activity.
And Move to Improve would help give them that.
Yes.
Give them that. Thank you. Any questions? Yes. Senator Edger.
I agree with you wholeheartedly on that, allowing the teachers to pick the time, they know when there's going to be a break. They know when they need to have a break, and it's not necessarily at 10:15 every morning.
Yes.
So I think, yeah, I agree wholeheartedly.
We know middle school students and adults in general, you have 20 minutes of my attention until I start losing focus. So we already, because I taught in a block, a 90-minute block, but I didn't have the students doing anything for more than 20 minutes at one time before shifting to another activity in the classroom. So, but if somebody told me that I had to put this 30 minutes in this, or this 5 here and this 10 here, that doesn't help me. But if I have access to, I can utilize that at any given time, then I can make adjustments and really incorporate it much more successfully.
Any other questions? Thank you, Christine.
Thank you.
Appreciate it. Next, we have Dale Lee, President of the West Virginia Education Association. Dale, welcome, and thanks for being here.
Thank you, Senator. I am Dale Lee. I'm the president of the West Virginia Education Association. I'm a teacher at Princeton Senior High School on leave while I'm serving as president. One of the things that has amazed me over the years is that I realize West Virginia leads the nation in obesity, and our approach to attacking that was only with the nutritional value and the guides that we had. Research will show you, and everyone knows, that it's a combination of nutrition, exercise, activity, and you really, as teachers, we focus on the mind, body, and soul of our students. So we have been a proponent for the past several years to increase the number of physical education teachers in the schools and the opportunities for them. Many of our students, if you think about it, from middle school through high school, are required to take possibly 2 years of phys ed only, one in the 7th and 8th grade and then one in the high school. That means that we're really not addressing the encompassing nutrition and activity for our kids. We've become an education system where we're focused on a test instead of allowing our teachers to get the kids where they need to be. Now, my initial thought with this bill, when Senator Unger, you approached me, was I don't want to see another mandate put onto our teachers. So I made several phone calls to elementary and middle school teachers across the state. What I found is what I've always believed, that I believe in teachers. I believe teachers do the things necessary to help their kids achieve. And when I talked to teachers, the first thing I said to them was, what do you think about 30 minutes of additional activity in the classroom? And teachers from across the state told me, we're already doing that. We're already, if I have a spelling lesson, we have the kids getting up and we're making them go through the motions in spelling and those types of things. Yeah, I was a math teacher in high school. And when I taught geometry, really I stumbled onto things accidentally. But I asked a kid one day to show me a right angle. And I'm thinking the kid's going to come to the board and draw a right angle. But no, he looks there for a second and he says, here. Well, my mind kind of goes off sometimes, and I ask the next kid, well, show me an acute angle with your arms like that. And so he shows me the acute angle. That's when the Macarena was a popular song, so it tells you how long it goes. So I developed the angle dance song, and all of my geometry students had to do the angle dance with that. So that reinforces what I believe. Teachers will use anything in their bag of tricks to help their students learn. I believe that all students can learn. I believe that all students can be motivated to push ahead. Now, what I don't want to see is saying a 30-minute required time and here's where you incorporate it and all that thing. I have faith in teachers. I ask that you have the faith in teachers too, that you let them incorporate this into their plans so that they know what's best for their individual class and their individual kids. With that, you're going to have to provide the resources and the time one of the things that will improve student achievement is the collaboration time with each other, with the teachers, so that teachers have the collaboration time with each other. If we're really serious about true education reform, and I commend the legislature for looking at it, I commend the Education Committee and Chairman Plymouth for really focusing on things that are going to move education forward in West Virginia. And bringing the teachers in and asking their opinions is the right way to go. It really, like I said, I'm a high school math teacher. And I have learned so much more about traveling across the state and talking to teachers from elementary school to middle school and everything. And that's why my first thought when you approached me was to make the phone calls and talk to the experts. This is something that most of the teachers across the state are doing now. What I heard repeatedly was, if it helps us preserve the activities, if it helps us know as an expert when my child needs recess to let them go out and do these things, then this is a huge step in the right direction. So the WVEA is supportive. The WVEA believes in teachers, believes that they will have the opportunity, and we will assist them with activities and plans and really the collaboration, the opportunities to share together on what's working in their classrooms and how we expand from that.
Thank you, Mr. Lee. So WVE supports Senate Bill 455, move to approve.
We support the physical activity. Since I haven't completely read the bill, I want to make sure that there's not anything in there that may draw up a red flag. But we absolutely support the physical activity and encompassing a child both physically, nutritionally, mentally, and the physical heart and soul of the child.
Okay. And we've had a request that you could demonstrate the ankle dance.
You really don't want to see that.
All right.
I tell you what, I may bring some of my former geometry students up, and they will show
We'd like to see
they will
this.
show the angle dance sometime. But again,
We get that on video, see, that thing will go viral.
when I saw the cameras, that's why I said absolutely not. No, we will not do that there. We may do a private showing sometime to let you know. But it is, teachers are creative, and teachers will do anything to get the concept across to their child. And so we reach into the bag of tricks all the time. This makes me nervous.
Oh, yes.
Well, I think that since we're requiring this in this bill, that we probably should require it here in the Senate. So we would like for you to demonstrate the first 30 minutes that we do it with that dance.
Okay, we will convene after the cameras are closed, and I'll lead you through the angle dance. So.
Okay, we'll learn that dance. Thank you. Any other questions? Any other questions? Well, Mr. Lee, thank you for being here, and we look forward to working with you.
Thank you.
Any other business come before our committee? As I mentioned, we don't have this bill. It'll be referred to education later today out of health. But just thought that give an opportunity to talk, since this particular committee had been working on this issue for the entire year. And the reason it wasn't originated is the president wanted to try to minimize originating bills, but also was introduced so that everybody even beyond this committee could get on it if they wished to do that. And I want to also thank the members of this committee, especially Senator Plymouth of Education and Senator Stallings, that have been part of that those discussions and utilizing their staff in helping draft it, with a very special thanks to Rita, who's really brought people together and stakeholders to really get into it. So we really appreciate that for Senate Bill 455.